Hello, everyone. I'm Eric Hartman, Director of Advocacy with the Choroideremia Research Foundation. Today's webinar is on eye donations, which is an incredibly important part of research. But before we start, I want to thank our sponsors, and that is Biogen, Spark, and Santec. Today we have three experts that I think will help all of you understand what it means to be an eye donor and why it's important. We have Onkar Sawant and Ashley Vanderdonck of the Eversight organization, and they deal with eye donations in the Northeast and North Central areas of the United States. They'll talk a bit more about that. And we have Dr. Malia Edwards, and she is Assistant Professor of Ophthalmology at the University of Pennsylvania. Sorry, got that wrong. Johns Hopkins, my mistake. Sorry about that, Malia. And in fact, I think we should probably start right away with Dr. Edwards. Dr. Edwards, if you want to give us a quick intro on the importance of an eye donor for choroideremia.
Can I go ahead and share my screen?
Please do.
Okay. I can get it. Sorry, let me just get the slideshow. Hi, well, thank you very much, Eric and the foundation, for giving me the chance to talk to you a little bit today about the importance of eye donation. As Eric said, this truly is extremely important to research and helping us understand disease in general, and especially in the sense of choroideremia, because we don't really have good models to study it. I just want to, sorry, I'm going to move this down here. So the first thing I want to talk to you about a little bit is a scientist's view of eye donations. As a scientist, we really truly see studying donor eyes as a privilege, and we realize that this is a big sacrifice for donors and families when they're entrusting us to their eyes as researchers. And therefore, when we get eyes, we try to get as much information as we can from each donation. And there's truly no better way to understand human disease than to look at donor eyes. So I'm going to go through a few slides that will kind of show you a bit of an idea of what we do with eyes when they come into the lab. So when we get eyes donated to the lab, the first thing we do is we'll remove the anterior chamber, which is the cornea and the lens, and then this allows us to view the posterior pole, which is the back of the eye. And we take pictures of this similar to get an image of what the pathology looks like. These two eyes are actually from two of the choroideremia eyes that we have received in the past. So this gives us a sense of just what's going on with the eye and how severe the pathology is. And we can see, you can see vessels, and here we can see some odd formations, but this just gives us a sense of what the eyes look like. So then what we'll do, in some one eyes, we will take, usually we'll divide the eyes. So we'll have one pair that will get one eye from each pair will be cryopreserved. So this means that we take the eye and we put it into blocks and freeze them. And this allows us to then go in section and look at all the layers of the eye at once. So this is just an example of a section through an eye. So you can see all the different layers at one time. So this is from a normal eye. And I'll show you some pictures in a couple of minutes of choroideremia eyes just to show you how we use this tissue. So in this, so right here, so in this sense, we can get an idea of what individual cell types we see, and we can look at specific markers for these cell types. So on the left here is a normal eye, and these are stained with, and the red is a marker for glial cells, which are one of the cells in the retina, and the green is photoreceptors. So this isn't a normal eye, and the blue is just the nuclei of all the cells. But when we look at the choroideremia eye, you can see the picture is much different, and you have here just a completely different picture when you look at the glial cells, again in red, and the photoreceptors in green, because the photoreceptors are primarily lost in the choroideremia, especially in advanced stages. So this just gives us an idea, and this obviously is a much different picture than what a clinician would see looking at OCT images or any type of imaging that they can do. So this really lets us see, look, and we have markers for every cell type in the retina, and we can actually look at specific proteins to try to understand what is behind the disease pathology. So that's one thing that we do. Other eyes, we usually take the other eye and we'll dissect away the retina and the choroid, and we'll separate those. And this allows us to really look at the retina and choroid as a whole structure and helps us to map the pathology as well. So these images, we take these images on what's known as a confocal microscope, which lets us see again at the cellular level. And these allow us to give, these are actually tiled images, so we can see the entire posterior pulse, the entire area, most of the eye. And you can see these are retinas, these are the retina here with red and green. And this white is actually the blood vessel staining. And so we get just a really nice, it gives us a really nice overview of the pictures, but then we can also, of the whole eye, but then we can go and look closer and look 3D. So this is just a choroid before I show you the closer ups. This is an example of a choroid. So these are normal choroid, and these are low mag, and then as we get a little higher, and then this is a choroideremia patient. So you can see there's a lot less choroidal vessels in the choroideremia patient over as the tissue has degenerated. So this is important information, and we can see these changes in vasculature much better at this level. These are things that clinicians don't see because we usually can't image this far into the choroid in a live patient. So looking at donor eyes really lets us see what pathology is happening there and when the pathology may have occurred based on how severe it is. We can also see entire cells. So you can see cells here. These again are retina images. And you can see some of the blood vessels, and these blood vessels actually are going into choroid as well, because what happens in a lot of choroideremia patients, as you probably know, you get a retinal scar, that forms between the retina and choroid that's made up largely of glial cells is what we're finding. And so this makes it difficult to separate the retina and choroid when we look at it post-mortem. So, but we're still able to look at them and go down with the confocal. And when we do flat mounts, we can actually take it and go through all the layers. The machine lets us do that. So we can look at individual layers in the flat perspective. So this is just another way to see the different cells. And again, we can stain these with multiple markers to look at any type of protein that we're interested in. This is an example of how we can use the whole mounts to correlate the retina and the choroidal pathology. So we can really start to understand how does changes in the retina correlate to changes in the choroid, and how do these, relate with the picture that we took at the beginning, where we can actually see, the disease pathology similar in a way to the clinician would see it. So this again is these are from a choroideremia patient, and you see here this top is the GFAP and dimension, which are glial cell markers. And these, below the white is the choroidal vessels. And you can see they're largely lost, except for in this area here in the far periphery. And this is where the disease has, the retina and the choroid have been spared. And if you look at this image on the right, you can see at the top, these little circles here are the RPE that has survived. So this gives us an idea of, we can see that if we have surviving RPE, we also have surviving choroid capillaris and the choroid. So this tells us that there's an intricate relationship between these, which we know, but it also helps us understand how the disease might progress, so we kind of know what's happening first or second. We can also see in these eyes that there's very abnormal, the glial cells are very abnormal, and they're making membranes, again, making this scar tissue. So if we can understand that formation, we can again help to understand the pathology and hopefully lead to better treatments for the disease. We can also again view singular cells. So this is just a couple other examples of the pictures that we can get seeing cells. So these cells are actually sitting on top of the retina. Again, just to demonstrate that we can look at multiple things, and it's really, we're on the amount of markers and proteins that we can look at in whole mounts is pretty unlimited. And so we can gain a huge amount of information and understand better the pathology of the disease. We also take some pieces and use 2-transmission electron microscopy. And this lets us look at things at an ultrastructural level. So this is the scale bar, if you can see it, is 2 microns. So this is very, very small. So we're able to look at individual pieces of the cells, not just a cell, but we're actually able to look at the organelles and specific structures within the cell to again help us understand how the pathology is occurring and what changes are happening in the cells, so that we can then, take a step back and think, okay, how can we try to prevent these changes from happening, and how can we better understand these, understand how we can prevent them, or are they good, look at how they might be affecting the disease pathology and to go from there. And we also take some eyes and we culture them. This is an example of some cells that we've cultured from a human donor eye. And this allows us to really look at how specific cell types respond to different factors without the influence of other cells. So if we found a cell that we felt was being affected in choroideremia, we could then take that specific cell and look at how different treatments or different growth factors or something might affect the pathology of the cells, so we could better understand what's happening in the whole eye. But this just lets us isolate specific cells at one time. So what information can we really get from these donor eyes? Again, they can really help us to better understand the pathology and reveal cellular changes, and clinicians can't see these changes because they can't see these individual cells. So it really helps us understand how the disease might be progressing. By understanding donor eyes, we can also help to develop better models, which will help, again, to identify cell types that may play a role in the disease. And if we can identify better models, then hopefully we can help, that will help to test treatments as well. And we can identify molecular and cellular changes that can, again, tell us the possibilities for new treatments or, at least new areas of study. So one thing that I think is really important to stress is the need for female carriers. The donor eyes from affected males are extremely interesting and obviously very beneficial, but these only provide a picture of the disease, and it's usually at the very end stages of the disease. So this only tells us kind of what has happened. And, as you could see from that one picture, you can see at the very edge of the eye what we can speculate what might be happening. But we can really get a better understanding from female carriers, because even if they have only a very mild phenotype or no phenotype at all, there might be more subtle changes that clinicians don't see, but that we can see, or even with the mild phenotype with the slower progression, we may understand more about how the disease progresses in the pathology. And I just want to emphasize that donation is a gift that will last generations. It's impossible to overemphasize the importance of these donations to really understanding human disease. And it is truly a way that an individual can really help future patients by leaving a lasting legacy. And again, as researchers, we are eternally grateful to eye donors and their families for really helping us understand retinal and choroidal disease. Thank you.
Thank you, Dr. Edwards. That is fascinating. And you were definitely hitting on many of the points that I wanted to make sure we were able to say to our patient community. Certainly, you will hear, if you're a patient, you were talking about the pathology and understanding the process. You'll also hear it described as the pathogenesis of the disease, how the cells cascade. And while CHM is known and has been known as a gene mutation, how it actually progresses within the multitude of different cells within the retina is still unknown. And there's so much in the future and developing now on new therapies, whether it's neuroprotective agents, RNA therapies, possible other therapies that might help with the Mueller glial or microglial. There's a lot that can be learned from it. And I greatly appreciate your work and your team there at Johns Hopkins. You guys Johns Hopkins first started as a funded researcher under the guidance of Dr. Jerry Luddy, and you have now taken the reins there at Johns Hopkins, and we greatly appreciate all the work that you're doing now. But as you say, it is a gift, and it is a gift that can be a touchy subject. And to better understand the donation process, I'd like to now turn to Onkar Sawant. Onkar, you may want to give a quick introduction of what your organization Eversight does, and let us know a bit more about the donation process.
Of course. Thank you, Eric, and CHM Foundation for giving us this opportunity to come talk about Eversight and how we could help in this process and achieve goal what just Dr. Edward talked about and gather some of the information from donated eyes. So let me go ahead, share my screen real quick. Can you see my presentation okay?
Yes, we can. Thank you.
Awesome. Thank you. So good afternoon, everybody. My name is Onkar Sawant. I'm Director for Research and Innovations at Eversight, and I'm joined by my esteemed colleague, Ashley Vanderdonck, who is our Clinical Partners Relation Manager at Eversight. So our mission is we restore sight and prevent blindness through the healing power of donation, transplantation, and research. So when it comes to the donation and transplantation part, we mainly provide, Eversight as an eye bank, mainly provide tissue for corneal transplantation. So corneal transplantation is the most common and successful form of transplantation that's been done. Eyes are the most frequent donated human tissue, as most of you might already be aware. The surgery that is required for corneal transplantation, it can be scheduled as an elective procedure and has improved quality of life of hundreds of people over the years. As an organization, we are located, our headquarters is located in Ann Arbor, Michigan, but we have offices in Chicago, Cleveland, Ohio, Clark, New Jersey, and as well as in Seoul, South Korea. As you can see in this map, the orange dots here show the location where we have provided tissue for corneal transplantation or tissue for research. Just as in an eye bank, Eversight in 2019 has provided more than 5,000 tissue from more than 5,000 donors for sight restoration. From all those tissues, we provided surgical graft for more than 8,000 recipients that are able to see for the work that we did. And at the same time, we provided more than 2,000 tissue for important research that can find cure for blindness. And this has been done through different researchers such as Dr. Edward here. Overall, eye banking industry in United States, in 2019, all eye banks in US together has provided close to 70,000 ocular tissues and helping more than 85,000 recipients to able to eradicate their blindness. As I mentioned before, corneal transplantation is very a successful surgery and more than 95% success rate has been demonstrated. And altogether, a study in 2013 showed that the lifetime economic benefit can be around 6 billion through corneal transplantation. So different eye banks, as I mentioned, there are a number of eye banks in United States, and we are located in Ohio, Illinois, Michigan, and New Jersey area. But I kind of want to provide you with these resources that you can access and find information of different eye banks. So if you just do a Google search of US eye banks in United States, you can go reach to restoresight.org. There, all the eye banks are listed. And as you can scroll at top, you can find a specific eye bank for your state. For example, here, if I click on Michigan, you can see Eversight name appear there. Here's one more example. Let's select Florida maybe. And you can see there are 2 eye banks from Florida that are listed here. So if there are anyone who wants to contact their local eye bank, please do visit restoresight.org/whoweare/find an eye bank to find your local eye bank. All right, so at this point, I'm going to pass on to my colleague, Ashley, to talk more about the process of seeking consent and procuring tissue. Ashley, it's all yours.
Thank you. So as Onkar said, I'm going to talk to you about the Donation Support Center specifically. They are the window to the eye bank, so they're the very first part of the process. And in the Donation Support Center specifically, I think you can click Onkar. Okay, actually, Yeah, we took out some animation, so I think the last slide messed up a little bit, so go back. So we do have a purpose statement in our call center. We designed it specifically for the call center. And that's really just to have the utmost customer service to our donor families, any hospital personnel, funeral homes, medical examiners that we speak with. And within the call center, we do have 3 primary, I guess, focal points that we cover. And so we talk with donor families and complete the preliminary donor screening and determination. We also provide family support and legal paperwork, which I will talk about both of those processes a little bit more in the next future slides. And then we also provide overflow services for our entire organization. So specifically, this is on the evenings and on the weekends. We will get calls from couriers about potential delays in tissue, or tissues not making it on a plane, or somebody who needs an emergency eye surgery. We handle those calls when they come in, so that there's always someone at our organization 24/7 to provide that customer service. Next slide, please. In 2019, this is just a little bit of our data. We had a total of about 23,000 referrals. That equates to about 63 per day. We had about 5,894 donors, and that's about 16 per day. And then inbound and outbound calls, we had about 396 per day, so 144,000. So we're very, very busy. We pretty much have anywhere from 5 to 6 staff on at all times to handle this volume of work. And it seems to be, enough staff to handle that volume. So moving forward. All right, so this is just a simple process overview of our call center. So as I mentioned, we screen cases and ensure donor suitability. We approach the donors' families, so we connect with them and complete any legal paperwork necessary. And then we will dispatch a certified technician who will do a quality check and complete the recovery. And we do all of this. Our goal is to do all of this in 5 hours and 45 minutes. So it's done fairly quickly following when someone passes away. Next slide, please. So as I mentioned, a little bit more of the breakdown of the screening process. So we screen cases with the hospital. We check donors against the registry to see if their wishes were to be an actual cornea donor. We complete any screening data entry into our midwire system. We place holds at our referring facility so that the donor is not released to a funeral home or a medical examiner's office without us being able to talk to the family first. We do connect with the funeral home to let them know of our involvement and that we will be speaking with the families. We screen for research potential using a application that we had designed for us. So we put all of our research studies in it, and it'll tell us if the donor, based on the criteria we put in, meets any research potentials. And then we determine the preliminary eye bank consent, which I'll talk a little bit more in a later slide. Next, please. Approaching. So these are the individuals who will talk to our donor families, and they will complete any required legal paperwork with the family. So if someone's on the donor registry, there is different paperwork we'll complete with the family versus if somebody's not. The donor risk assessment interview is also something that is done. That's a series of medical questions, very similar to those asked when someone donates blood, that we have to complete for every donor that we see surgically fit. And then we complete any of that data entry that needs to be done for the approaching process. Next slide, please. The dispatching process, we quality check all the paperwork and data entry to make sure the screening and the approaching data entry and everything was entered correctly and all the paperwork is completed correctly. We verify where the donor is located. At times, donors, as we talk to the hospital, we ask them to keep the donors there, but things happen, and sometimes they get released to funeral homes or to medical examiner offices. And when that happens, we need to make sure we know where that donor is at before we send that certified technician to do the corneal recovery. We do obtain the medical examiner and coroner release. Oh, sorry, back. And we do complete all the data entry as well. And then when everything is all done, we ensure all the holds are released so that when the donor is at the hospital, they can then be released to the funeral home or the medical examiner's office, and the process can move forward. Next slide, please. So we do have variations in case types, intents, and registry status. So with case types, we have what's called an I-only case. With those types of cases, we will talk with the hospital and get additional medical information, and we will also talk with the donor families. However, for tissue I cases, organ tissue I, and organ I, our organ procurement organizations that we deal with in each of the states that we work with, they will talk with the donor families and with the hospitals, and then we just collaborate together and recover the corneas for Eversight, and then they'll recover any tissues or organs that donor may be eligible for. Intent, donors can be eligible for surgical only, research only, or both. With both, a lot of times it is research corneas surgical corneas and like research posterior parts. And then the registry status, someone who is signed up on the registry when they go and renew their license is called a first person consent. That's them stating that they wish to be a donor. And then we have non-registered donors or non-first person consent. The difference here is really our communication with the family. When somebody is on the donor registry, we are simply calling the family to let them know of their loved one's wishes to be a donor and to complete what's called an acknowledgement and a donor risk assessment interview. When somebody's not on the registry, we actually have to complete a legal authorization form because they are authorizing us to move forward with the donation. And then also that donor risk assessment interview. So they're two separate conversations. We're not asking for permission on someone who signed up on the registry because they've given us that permission already. However, it's really, really important that your family knows of your wishes, because if your family does not, and they believe that you signed up accidentally, or, just believe that you didn't really sign up, if we do not have their blessing to complete that donor risk assessment interview, we cannot move forward with the donation. So we really have to have the families in agreement with the donation, even when somebody signs up on the registry. Next slide, please. And that's what I kind of talked about a little here. So a first person authorization can be a donor registry authorization or a living will. So we do ask about that every time we talk to the hospital if there was a living will. The next of kin is notified of the donor's wishes, and that document is a legal binding decision. In some of the states we work in, we will make one good faith attempt to talk with the family. If we're not able to reach them on that one good faith attempt, then we will go ahead and recover their gifts. And we will still then try and reach the family to complete that additional paperwork needed to actually utilize the gifts. Where a next of kin authorization, this could be obtained in person, written a lot of times with organ cases, they're obtained in person, or it can be obtained on the phone. Everything is done always on a recorded line for legal purposes. And it's done by trained personnel. So all of our coordinators in our donation support center are trained. They go through a 1 to 2 month process to be trained. It could be from the eye bank, the tissue bank, or the hospital personnel who does that authorization and has that that training to do so. And now I'm going to hand it off to Onkar to talk about the rest of the donation process overview.
Thanks, Ashley. I think that was very helpful to explain the process. So thank you for doing that. So once the donation support center dispatches on a case, what happens after that is tissue recovery. So as you can see on this flow, this is a point where case is dispatched, recovery technician goes and recovers the tissue. But after that, there are a number of steps that we follow. So we do the testing for infectious disease to make sure we are not passing on any contamination from donor to recipient sides. We perform tissue evaluation because that determines the quality of tissue. During this time, donor eligibility determinations are made. So this is a time when we are receiving all the testing results to make sure donor is suitable. After that time, when tissue is deemed suitable, tissue is processed based on different surgeons' need, and then some of the final evaluation steps are performed, and then tissue is distributed for corneal transplantation. So these latter steps are not performed for all research tissue. However, still donor eligibility is conducted to make sure we are not providing a tissue to our researcher that has any contamination. So Eversight has recovery location in different states that we mentioned earlier. So these expert clinical technicians are dispatched to different locations to procure eye tissue that are unable to gift off site through transplantation or clinical education or research. And Ashley already talked about this a little bit. So the recovery can be either surgical intent, so we can have a donor cornea used for corneal transplantation that somebody could restore their sight tomorrow, and then the rest of the eye, especially retina and RPE, could be used for research intent. So tissue can be either surgical or research or dual intent. And I just want to give you one example now how we are able to use donated eye tissue to understand different disease processes. And here's the one example for this disease called MPS IIIC. It's the retinitis pigmentosa-like disorder. So the patient that have this genetic condition have severe neuronal abnormalities, but at the same time, their retina is severely degraded as well. So this is from a mouse model that one of our collaborators identified there is a severe retinal degeneration. As you can see, the left side is a healthy mouse eye, but the right side is the disease model eye. So when they approached us to see if we could understand this phenotype more from donated eyes, we were able to recover eyes from healthy control donor, as well as the MPS IIIC deceased donor. And as you can see here, the left panel is from the peripheral retina, and the right panel is from the central retina. So the top portion here, these are images from healthy control eye. As you can see, shown here by the dotted red lines, the photoreceptor layers where the rods and cones are present, they are pretty much in good shape and healthy. But when we look at the diseased eye, in the peripheral retina, they were severely thin. And if you look at the central retina, there is abnormal localization of different tissues. So there was accumulation of fluid, and also the different retinal neuronal layers were highly disorganized. So once we presented these findings at one of the conferences, a family that has MPS IIIC patient in their family were able to came to know about this, and they took their son for the retinal imaging, which did not have any manifestation of ocular complaints. But when they performed the imaging at early on, they were able to find that their patient actually had severe macular edema. And then hence then this has been treated and able to improve their vision. So the research that has been done through donated eyes could help to see some of the phenotypes that are missed by some other clinical evaluations. So just kind of want to highlight that research using donated eyes is very valuable, and then microscopic characterization actually helps understand the disease process. So with that, I would like to thank all of you for listening, and Foundation for giving us opportunity to explain what work we do. So with that, I'll send it back to Eric.
Thank you, Onkar, and thank you, Ashley. The work of Eversight is very, very important. And what you have seen here by their examples is where the research can help with clinical donations. Much of what they were discussing are eye donations that many people will sign up for. And in a number of cases, I think last year there were 70,000 eyes donated, and the vast majority were used for cornea transplant. But in the case of choroideremia, the entire eye is going to be donated and shipped directly to Dr. Edwards. It is incredibly important, as Onkar was saying, that this, and Ashley, that these donations are processed quickly. if we are CHM patients and we are not in the area where Eversight is, and even if we are in that area and we want to be donors, the CRF has a consent form that is downloadable along with a donation card. But I think it's incredibly important for we as family members or as donors to let our family know what our wishes are. And it can be early on. It's never an easy subject to bring up. And part of what can make it easier, all of us want to live long lives, but I am already signed up as a donor, but I want to go ahead and make sure, living here in New Orleans, that I know where the nearest eye bank is. And I can have some of that information with my normal papers. And I've even, I will save some of that even on my phone as a reference file. So it's always with me. But yeah, I think it's incredibly important that our patients know it is a huge, huge gift to better understand choroideremia. Beth, maybe you can switch us to gallery view, if you can. We have Beth Foss handling the technical end.
Yep, actually, oops, sorry. Actually, it was set up in gallery view, and I think
okay.
our audience can see gallery.
Okay.
They should be able to see it in gallery view. Kathy wanted me to just chime in here as she put in the chat box. Additional CHM eye donation information and consent forms are on our website at that curechm.org.
Yeah. Yeah, and you can download that. It wouldn't be bad to go ahead and get the donor card filled out, and you could then get it laminated and put in your wallets to carry with you. The thing that Dr. Edwards, you may want to talk to this too. There is a definite need to get the eye there as quickly as possible because we want to make sure we can get to the cells and to view them as quickly as possible. Correct?
Yes, exactly. And the faster we get it, the better analysis we can do of the pathology and better understand the disease. And I think that's, as you mentioned, the importance again of making sure your family is aware of, because even an hour or two delay in getting the eyes donated, getting the process started of the eye donation can, really affect what we're able to do with the eyes and the quality of the tissue. So I think that's really an important thing to emphasize. And yeah, just have an eye bank identified. If you want to donate your eyes, a place identified where they can take your eyes, and just making sure that your family, as Eric said, it's not a easy conversation to have, but it's, once your family knows that and is aware that that's your wishes, then that's your you have that chance to, donate.
Absolutely. Yeah, we want to make sure that these are shipped out ASAP. If there's ever any question on the end of a donor, know that if there is any expense for like the FedEx shipping, the overnight shipping, we'll reimburse any patient for that. Sometimes these things, none of us have any calendar knowing when we're going to pass away. So it's always a very difficult and very emotional part of our whole process of living. But it is the gift of these eyes. Many of us have heard about the ability of growing new RPE and photoreceptors from induced pluripotent stem cells from either eye or blood. Well, that's only in a dish, and that's not what the eye looks like. And there's only so much that can be done with imaging. And I really want to say, I think there's probably, I can say for a fact, there's probably less than a dozen eyes that have had papers published. And I think the number is probably more like 6, but it is incredibly important. And the other challenge is we're very, very rare. So this is even a more rare gift than just the average eye, not to diminish those, but to gain the knowledge of what a choroideremia eye looks like, whether from the male patient or the females, we can learn a lot. And there's so much going on in science right now that, you know, if any of you are in a position to consider this, we ask that you make a very serious consideration, because I think it's incredibly important for the future of CHM research. Beth, do you have any more questions for us?
We do. We have a couple questions here. Brian is asking, I've already donated my entire body to science. Does this preclude me from donating my CHM eyes?
No, it doesn't. Excuse me.
Actually, it's
Yeah,
hard to
it does not.
it's hard to see for people who are low vision. Do you want to speak to that?
Yeah.
Sorry about that.
Most of the whole body donations that we have worked with, I've been at Eversight for 13 years, and I'm not aware of any whole body donation that has refused for us to allow corneal and eye donations to move forward with somebody donating their body to science.
And yeah, and I think it's incredibly important, because all of our families know what it has been like for us to grow up living with choroideremia in our family, whether it's carriers or as fully affected patients. And if this is something that we can do, I think discussing it with your family will open many doors and make it a bit easier, because there's a lot, even if it's just the eyes, whether you're donating any other organs or not, it can easily be done. And from the funeral director end of it, you know, if they do decide to have an open casket, there are ways of taking care of that, so you'll never know that the eyes were harvested. There are, as I said, 70,000 eyes are harvested annually. And so it's not like it hasn't been done, and all of the people that handle the remains know how to handle that. So families should be, well aware that there are no problems from that. Any other questions?
We do. Do you have any specific like notes or discussion points or bullets that we could share with our family members when we have these discussions? You know, oftentimes, as I shared before we got started, some people were on board. It's oftentimes the daughter carriers that are having these discussions with their fathers, and also themselves as carriers, and their potential sons and daughter carriers. So there's a lot of responsibility, if I can say it that way, or there's a lot of ability that these carrier daughters have, but it sure would be nice to have some kind of a checklist, or try opening the conversations with these types of statements. It's kind of hard to navigate. Do you guys have anything like that that we could use?
I guess that's going to the Eversight group.
I would say anybody, yeah.
Yes.
I'm kind of seeing, well, maybe not. Maybe we just need to come
Well,
up.
it's something we'll need.
Oh.
I think we have, there is a lot of explanation on the importance of it within our consent form, but I think we can easily put together, you know, a few bullet points, because it's certainly not a subject that many people want to talk a lot about ahead of time. And it does need to be talked about ahead of time. And the easier we can make it, we will definitely have that up. We'll get a bullet point, you know, of anywhere from 5 to 10 quick points that will emphasize why it's so important. And we can also have that available.
Yeah, we do have some generalized information about the discussion with family members, but we can certainly help to make it more personalized for CHM with respect to genetic mutation and how it affects carrier versus actual patient.
That'd be great.
That'd be great.
That would be great. Any other questions, Beth?
No, right now that's it. No, I think it was so well covered. We don't have any other questions in the queue right now in the chat. Let's just give it.
Question, actually, about so with the whole body donor, how does that get directed so that they know that it's a CHM patient? Do they need to have something, you know, because that I mean, I would imagine that could easily get put in, and you know, they may not know if it just went to any service, they may not understand the importance of CHM. So I wonder if you need to have, then this would be for Onkar and Ashley, if there needs to be something in there that, you know, I'm a CHM patient, or, you know, fill out your authorization form as well, so that we make sure that the eyes get to the right, you know, to researchers to actually study the disease and not just, you know.
Yeah, specifically for our locations, we would definitely need the family to share with us upon notification of someone passing away, when we speak with the family, that they are a CHM donor or they are a candidate, so that we know that this is a direct donation, is what we would call them, and that they're going for the Choroideremia Research Foundation. So that would be something we would need the family to let us know.
Yeah, I think, Ashley, that's direct to the point. And that's, I think, part of the importance of having this webinar is letting, there are many of us that say, yeah, you can have my eyes, but we need to let our families know. We need to let them know ahead of time. We should mention it every so often, just to let them know so they're cognizant of it. And again, carrying the donor cards with you would help. But it does, like I said, these eyes do need to get harvested relatively quickly. And to be within 24 hours to 48, I think is optimal. Is that correct, Dr. Edwards?
Yep.
Yeah. Yep. So the quicker we can get it there, the better it'll be. And in order to do that, it's not only the generosity of the patients and the carriers that are making this choice. It is going to also be their education of their own family members to make sure that their wishes are in fact followed through.
Kathy, our executive director, also is in on this conversation, and she just wanted to make sure that we stressed once again that this information is on our website, and our form specifically states that Dr. Edwards, her address, her name, contact information, and that the donations would get specifically to her. And families can take that document, you know, of course, to the eye bank so that they have all of that. So that's really important. Yes. Trying to make it as easy as possible, right?
We want to make it easy. It's not an easy subject to discuss with a family, but I think the better informed the families are on how this can help future CHM research, I think they will understand and want to meet the wishes of those that are making such a generous gift of the donation of their eyes for research. Well, I want to thank everyone here for their time, Onkar, Ashley, and Dr. Edwards. Thank you all. Definitely, Eversight has been a great partner with the CRF in helping us get this set up and given us guidance along the way. And it certainly has made us aware, you guys have made us aware of avenues that our own patients can find the eye banks nearest to them if they're not in the Eversight areas. And we can move forward with this because there is so much hope for the future of CHM research. And to have these donor eyes, it will just help us get there quicker. So again, thank you everyone for your time today. And we want to also, again, thank our sponsors, Biogen, Spark, and Santec. These educational series are ongoing, and these will be also posted on our website. So again, thank you everyone, and we will look forward to having you at our next webinar. Thank you.
Thank you.
Thank you.
Thank you.